Welcome to this explainer. Today, we're taking a deep dive into a really fascinating qualitative metasynthesis of psilocybin treatment experiences, straight from the International Journal of Mental Health Nursing. And what's cool here is that we aren't just looking at dry symptom checklists today. Instead, we're going to explore the deeply human, subjective journey of healing. How do patients actually describe what happens in their minds during this treatment? Let's find out.
Okay, let's jump right into the mind of a patient to get a feel for this. One participant described their experience like this. The reset switch had been pressed, so everything could run properly. I mean, that perfectly captures how this treatment isn't just about, managing daily symptoms. For these patients, it's about fundamentally unlocking the human mind. They literally describe this feeling of having restricted networks suddenly open back up. But to understand how we actually arrived at this point clinically, we need just a little bit of context.
Section 1. An ancient medicine returns. To understand these profound subjective experiences, we first have to ground ourselves in the history of this compound.
Talk about historical whiplash, right? Just look at this timeline. We start over 3,000 years ago with indigenous ritual use in Mexico, where it was utilized for profound healing. Fast forward to 1957, and it's officially isolated in a lab. But then hit 1970, and it gets designated as a Schedule I drug in the US, basically locking it away in the dark for decades. But follow that all the way to 2018, and the FDA suddenly designates it a breakthrough therapy. It's kind of ironic, isn't it? We went from thousands of years of traditional use to total prohibition, only for modern medicine to miraculously discover it as a breakthrough today.
Moving on to the science of psilocybin. Now, what's really wild about this modern resurgence is the staggering variety of clinical conditions researchers are testing it against.
Just consider this incredibly diverse list drawn directly from the metasynthesis we're exploring today. We're talking about patients dealing with end-of-life anxiety from cancer, deep-rooted depression, HIV-related distress, substance use disorder, smoking cessation, and even severe trauma. These are vastly different physical and mental ailments, and so this leads us to the core question of our explainer. Despite suffering from such wildly different conditions, do all these different patients experience the exact same thing during psilocybin treatment?
Well, biologically speaking, psilocybin targets something called the 5-HT2A receptor. When stimulated, it temporarily disrupts the rigid brain circuits that encode negative rumination. It causes a temporary disintegration of what's called the default mode network. Think of it kind of like a ski slope. Depression or addiction forces your brain down the same deep, rigid, icy tracks every single day. Psilocybin essentially smooths out the snow, allowing the brain to break out of those entrenched ruts and form entirely new, flexible ways of thinking.
Now, we definitely need to clarify what happens here, because hallucination is a pretty loaded word. The clinical psilocybin experience is fundamentally different from a psychotic episode. Psychosis is typically dominated by auditory hallucinations and a terrifying loss of reality, where the patient completely loses their sense of insight. Psilocybin, on the other hand, is predominantly visual. Patients see bright, geometric forms and complex landscapes, but crucially, their insight remains totally intact. They know they're in a clinic, they know they've taken a compound, and they maintain complete awareness of what's going on.
So how does this affect the patient? That brings us to the first of the three core thematic pillars discovered across all these disparate patient studies: the power of acceptance.
Across all those different conditions we looked at earlier, patients consistently described finding a new, enduring way of thinking. They moved away from anxiety, resentment, or fear and moved toward true acceptance. Now, to be clear, this isn't just throwing in the towel and giving up. Rather, it's a non-judgmental acknowledgement of the self and their clinical condition. They learn to accept their own perceived flaws and even their terrifying medical diagnoses without that heavy, crushing burden of judgment.
Just listen to the emotional weight of this patient quote. For someone facing a terminal illness, cancer is almost always viewed as an invading enemy. But through this therapy, the patient realizes cancer is a part of everything. It was just a sort of acceptance of the human experience. It's incredible. It beautifully demonstrates how the rigid, isolating fear of a terminal illness was softened into this peaceful, universal acceptance.
Building upon that foundation of acceptance, we enter the second pillar of the therapeutic journey: reconnecting to the world.
Illness is inherently isolating. Conditions like depression and trauma are fundamentally diseases of disconnection that cut you off from the world and trap you in your own singular perspective. Breaking that cycle requires a massive, radical shift. And patients across these studies reported a lasting shift from that painful isolation to a profound sense of interconnectedness. Not just with their family or their therapist, but literally with nature, the environment, and the wider universe itself.
And this quote brilliantly illustrates the contrast between the often sterile environment of a clinical trial and the expansive, life-altering connection these patients feel. It's the first time I ever really felt like I was part of the world instead of separate from it. I mean, imagine being a patient suffering from the deep, heavy melancholy of depression and suddenly feeling truly woven into the fabric of the universe. It effectively cures that sense of profound emptiness.
So, when you combine genuine acceptance with deep connection, the final result is the third and final pillar, the transformative experience.
This is where the healing truly cements itself. Transformation here isn't just a fleeting feeling. It's a structural change in how these patients live their lives moving forward. By experiencing ego dissolution, which essentially means the strict, guarded boundaries of me versus the world temporarily melt away, patients found profound new insights. They developed intense self-compassion. They found freedom from the heavy burdens of their past. And for patients dealing with substance abuse or smoking, this transformation provided the actual, tangible motivation they needed to change their negative behaviors.
I absolutely love the imagery in this quote, using the compound as a metaphorical headlight to find free space in a burdened mind. This shows exactly why these patients describe the experience as a true healing transformation rather than just temporary symptom management. They aren't just dulling the pain for a few hours. They are shining a bright light into their minds and finding the space to actually breathe, process, and heal.
Now, to be totally objective, we must note that this isn't always an easy trip. The data clearly shows that some patients do experience what's called transient psychological distress. Early in the session, as control starts to slip away, there can definitely be moments of fear or feeling overwhelmed. But here is the crucial part. This challenge is almost always resolved. How? Through the simple, grounded reassurance and social support of their attending therapist. This highlights exactly why the clinical setting, the therapeutic set and setting as they call it, is absolutely vital to the safety and success of this entire process.
Let's step back for a second and look at what this deeply subjective emotional data means for the future of clinical practice in a new mental health paradigm.
The researchers point out something really incredible here. Even without administering psychedelics, mental health nurses and practitioners can integrate these exact same pillars into their care right now. Step 1. Therapeutic strategies can focus heavily on promoting self-acceptance of a clinical condition. Step 2. Healthcare workers can actively counter the isolation of illness by fostering connection. And Step 3. They can help patients integrate these personal insights into their daily lives. The psychedelic experience essentially acts as a magnifying glass for the exact principles of recovery that mental health nursing already strives to achieve every single day.
As we wrap up this explainer, I want you to consider the broader implications of what these patients have shared with us today. If, at its very core, psychological suffering is driven by rigid isolation, and healing is a journey of profound connection, are our rigid modern healthcare systems actually prepared to make room for an ancient medicine that heals by fundamentally reconnecting our minds to the world around us? It's a huge question, and one that researchers, lawmakers, and medical professionals are going to have to answer very soon. Thanks so much for joining me on this deep dive, and keep your mind open to the science of tomorrow.